It's like, do you have problems tracking? I'm like, and I lost track.
After a car accident caused a major concussion in 2017, high school senior Abby Capps continues to deal with symptoms of her brain injury every day. A concussion or traumatic brain injury includes any action that causes shaking or movement of the brain inside the skull, causing damage to different parts of a person's sensory and motor processing system. After a brain injury, patients may report a range of symptoms.
When I was in class taking notes, I would be looking down, and then I'd look up, and I'd look down and look up, and I would get really dizzy, and it just hurt, and I would feel like I was going to pass out. Doing the level of the pace and how fast it was, my brain just couldn't keep up.
Abby's attention levels ranked in the 5th percentile, and her reading level was at the age of a 6-year-old. That's when Abby's physician referred her to a vision therapist, an optometrist that specializes in treating how the brain processes visual information. Visual symptoms following a concussion can cause discomfort in a patient's everyday life, and vision therapists use tools like these to bring a patient's vision back to normal. Dr. Katie Davis is the vision therapy specialist who diagnosed Abby with specific vision symptoms.
So we look to see how the eyes move, how the eyes team, and how the eyes focus. And those are the 3 main ways our brain collects visual information. And usually they really don't have anything to do with how well a person sees.
Even if a patient has 20/20 vision, he or she may still have vision symptoms due to the brain not processing visual information correctly. Dr. Davis uses tools like electronic timing mechanisms, different buzzers, and activities to correct symptoms like blurred or double vision, and to help patients return to daily activities like taking notes in school or reading.
We don't really think of vision as something that we learn to do, but vision is actually a learned skill. So a lot of times people don't realize they're doing their vision wrong.
When she gets to her left side, her eyes are no longer able to keep pointing at the ball. And you can imagine how disruptive that would be while you're trying to read.
And so we have to select activities that show a patient how they're aiming their eyes incorrectly, for example, and then how to correct that.
After graduating vision therapy, Abby's attention levels have greatly improved, and now she reads at the level of a 16-year-old. As Abby heads to college in the fall, it's vision therapy that helped her decide to pursue a career in the medical field.
And I can work with patients that have concussions or other brain injuries. So it's kind of turned me into that way of wanting to help.
Even with progress, Abby's life is forever changed, but vision therapy has helped put her life back in focus. For Carolina News, I'm Madeline Stewart.